why don't more agents offer hospital indemnity plans? Many agents, when we talk to them about it, say, I'm afraid of screwing up the sale that I've got. And you know what? Guess what, guys? I'm going to quote Mike Tomlin, the football coach here in Pittsburgh. We do not want to live in our fears. Good morning, insurance agents of the senior market. Welcome back to another episode of Near and Far. It is Monday, October 4th, the first Monday of the AEP. Woo! I probably won't be doing this for another 54 days. I probably won't be like, it's the 7th Monday of AP. Probably not. I don't know. Maybe I will. But again, Monday, October 4th, we're really getting rolling into Medicare enrollment season. And over the next 3 months, agents are going to have significantly more appointments than they probably will January through September. I mean, this is the busiest time of year for all of you that are engaged with the senior market. So why don't more agents offer hospital indemnity plans? Many agents, when we talk to them about it, say, I'm afraid of screwing up the sale that I've got. And you know what? Guess what, guys? I'm going to quote Mike Tomlin, the football coach here in Pittsburgh. We do not want to live in our fears. Like, that is not how we want to operate as agents in the senior market. You guys are professionals. So let's talk a little bit about hospital indemnity. So I'm going to give you 3 keys on how to offer and, more importantly, how to sell hospital indemnity plans during the Medicare Advantage appointment. So first, recognize the client you're meeting with. They're comfortable with the MA value prop. Like, you just went through a needs assessment, a sales presentation, and you just closed the sale. That client made that decision that they're happy with it. They feel good about the decision that they made. You are not going to screw this up. It's not going to happen. The client is not all of a sudden going to take that application that they just signed and checked all the boxes and said, no, I don't live in a long-term care facility. No, I don't have Medicaid. They're not going to do that and tear the app up. It is just simply a way to offer them an option to offset exposure that they just said, yes, I'm comfortable with this. So second key here is you should identify that inpatient hospital copays, that's their likely highest exposure. So if we think about it, 17% of adults over the age of 65 get hospitalized during the course of a year. It's about 1 out of 5. It's not quite 1 out of 5, but it's pretty close. So if you run 5 appointments in a day, okay, and a lot of agents on an AEP day, they've got a 9, an 11, a 1, a 3, maybe a 5. So there are a lot of days that agents will have, 5 appointments in a day. 1 out of those people is going to the hospital. So at some point during the calendar year for the product you just sold. It's a whole lot easier to project that as a likely point of exposure than it is what percentage of your clients are going to get cancer this year. And the cost sharing ranges on a number of plans. We've got some plans that've got per admission, hospital copays other that are per day. But if we look at the average exposure for someone, you're probably talking about $300 a day. If you have a 3-day hospital stay, it's $900. That is a likely exposure for at least 1 out of 5 of the consumers that you're selling. Third key here in terms of hospital indemnity and the Medicare Advantage appointment, offer it to them as a this or that. So option 1 is easy. Stay with the coverage you got. You just made that decision as the client that, yes, I feel comfortable with this plan. I want this plan to be my health insurance coverage for the upcoming calendar year. That's option 1. Option 2 is say to the consumer, hey, if I could offer you a plan that would cover that 3-day hospital stay and your $300 per day copay for $27 a month, would you want to learn more? Would you feel more comfortable with this plan as it is, or adding $27 a premium and knowing you got a 3-day hospital stay, it's covered at 100%? Is that something you'd be interested in talking more about? And then go from there. But just keep in mind, again, I know I'm circling back to this fear factor, okay? The client isn't going to tear up the app. They're not going to kick you out of their house and, throw a gallon of paint on you. It's not going to happen. Offer it to them as this or that. And, if they're comfortable with the plan as it is, awesome. ask for a referral. I know I say that all the time. Ask for a referral and tell them to have a nice day. If they want to learn more, you may have just made them happier with the plan selection that you've got. And by the way, you just earned some additional commission to help offset your lead cost. So just keep in mind as you're rolling through all these appointments, this is your busiest time of the year. And I know sometimes the appointments are stacked really tight. Don't forget, or more importantly, don't be afraid to offer hospital indemnity plans to your Medicare Advantage clients. So we'll be back with you on Wednesday, October 6th, the first Wednesday of the AEP. At some point I'll stop doing this, I promise. But we'll be back with you on Wednesday for a little bit more of Near and Far. I'm Bill. Have a great start to your week. We'll see you later.